All right, Paul, we are now live. You can proceed.
Okay, good afternoon, everyone. Thank you for joining us as always. Before we get started with our COVID-19 update, we have a brief message for our Spanish-speaking viewers, just to let them know that a translated version of this broadcast is being streamed live on YouTube. Sylvia?
Buenas tardes y bienvenidos a la conferencia comunitaria con la doctora Mase. Ahora la doctora nos dará una actualización sobre coronavirus y esta actualización se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español puede usar el link de YouTube que se incluyó en la descripción de esta publicación en Facebook. Muchas gracias.
Thank you, Sylvia, and thank you all for joining us for this, our Wednesday briefing on our coronavirus situation in Sonoma County with Dr. Sundari Mase, our County Health Officer. Before we go to Dr. Mase, I want to remind everyone that you are invited to submit questions today to Dr. Mase, whether it concerns the recently released guidelines on celebrating Halloween this year or something else. You can do so. You can submit your questions by emailing them to publicaffairs@sonoma-county.org. Once again, that's publicaffairs, one word, @sonoma-county.org, or by leaving your question in the comments area of the Facebook Live page or the YouTube Live page. You can leave them in either Spanish or in English. And with that, we will go to our presentation. Good afternoon, Dr. Mase.
Yes, good afternoon, Paul. Thank you so much, and thank you everybody for attending today. I'm Dr. Sundari Mase, Sonoma County's Health Officer, and this is our update for our COVID-19 situation as of Wednesday, October 14th. Our most recent numbers show that we now have 8,558 confirmed cases, an increase of 58 cases in the previous 24 hours. These include 1,539 active cases and 6,891 people who have recovered. We have no new deaths reported in the last 24 hours, so the total number remains at 128. We have now completed 193,666 COVID tests so far. As you know, every county in California is assigned to a tier based on the local metrics. Based on this week's numbers, Sonoma County remains in the most restrictive purple tier. Our daily case rate of new cases per 100,000 population is 10.6, and it must be less than 7 to move into the less restrictive tier. Our testing positivity rate is 5%, lower than the 8% required to move to a less restrictive tier. The equity metric testing positive rate that we've talked about previously, the test positivity rate in the lowest quartile of socioeconomic status in our county is 7.5%, which is also less than the 8% needed to move into the red tier, and that has dropped from 8.1% last week. So in order to move to the red tier, we must either meet the state's benchmarks for all 3 of these for 2 weeks, or meet the test positivity benchmark and have an equity metric rate of less than 5% for 2 weeks, even if our new cases per 100,000 per day is still above the benchmark for the red tier. So this is what we're striving for. Many in the community, I understand, are frustrated by the many challenges facing Sonoma County in its efforts to open schools and the economy safely. The primary drivers are socioeconomic disparities that pressure essential workers and those living on limited incomes to go to work despite safety concerns. Without sick leave or job security, these workers simply cannot afford to miss a shift. In addition, lower incomes cause people to share transportation, more people are housed in less space, and there are fewer childcare options. Many of these folks are also hesitant about accessing government services, such as our alternate care site, where those with COVID-19 who are positive can isolate and those who are contacts can quarantine, thereby limiting transmission of COVID. So the county is responding by developing a robust, multi-pronged approach to address these equity gaps, with the goal of bringing down our total overall numbers, but specifically the equity metric. Potential solutions include even more ramped up testing. As you know, we've been doing a lot of pop-up testing in the Latinx areas and the places that have been hardest hit by COVID, but we will be ramping this up even further. Incentives for financially vulnerable essential workers to stay home when sick, hotel vouchers for isolation and quarantine, increased partnership with our business community, expansion of our data-driven testing, and enhanced outreach to impacted communities. If we support essential and low-income workers, we can access the accelerated progression provision of the equity metric. This means that even if we have a new daily case rate that's above 7 per 100,000 per day, that is, we can still move into the red tier if we can get that equity metric, that is the test positivity rate in the lowest quartile in the county, below 5%. We're working closely with the Board of Supervisors on budgets and timelines to roll out this comprehensive campaign. In other news, I have an update in the county and state guidelines for helping our community stay safe as we celebrate Halloween and Dia de los Muertos. Examples of safe Halloween alternatives that are encouraged within specific guidelines include online parties, car parades, drive-in movie nights, Halloween-themed meals at outdoor restaurants, outdoor drive-through haunted houses, traditional activities such as door-to-door trick-or-treating, business-to-business trick-or-treating, and trunk-or-treating are strongly discouraged. Following recent state guidance for private gatherings, only outdoor gatherings of 12 or fewer people from no more than 3 separate households are allowed. Each person at an outdoor gathering must maintain that 6 feet of distance from non-household members and wear face coverings and practice good hand washing and other hygiene measures. Higher risk Halloween activities that are not permitted include carnivals, festivals, live audience entertainment, indoor haunted houses, indoor gatherings, events, or parties with non-household members. Many Dia de los Muertos activities are permitted and encouraged. These include visiting and decorating the graves of deceased loved ones while maintaining social distancing, wearing face coverings and washing hands frequently, preparing food or playing music enjoyed by loved ones, decorating images and objects in your home in their honor. Outdoor gatherings are permitted if there are 12 or fewer people from no more than 3 households, and as long as face coverings are worn, social distance with those not in the household maintained, and hygiene standards are met. Indoor gatherings, events, or parties with non-household members are not permitted. Carnivals, festivals, and live audience entertainment are also not allowed. As many of you know, we made these guidelines public on Monday, and we're pleased to see that the state also came out with its own guidelines for Halloween on Tuesday, and that those guidelines follow closely with our own guidelines. So for more information about how to celebrate safely for these festivals this year, please go to socoemergency.org, where you'll find our recommendations and guidance. This is the end of the presentation, and I believe that now we are ready for questions.
Great, thank you, Dr. Mase. Yeah, so we'll go to questions now. Just want to remind our viewers that if they want to submit questions, they may do so by emailing to publicaffairs@sonoma-county.org or by leaving questions in the Facebook comments area on the Facebook Live streaming. Also, our friends in the media are going to can raise their hands, and we will call on them as we go back and forth between our public and our media questions. So let's start with one from the public. Dr. Mase, Amy asks about, have you approved more school waivers, particularly those for private schools? Do you have any update for us on that?
Yeah, we've had updated applications from 11 of the schools that we requested information from, and we're still working on getting very specific plans from these schools. So as you know from the press release last week, we did approve the one school to open the presentation school. A few schools withdrew their applications. And again, we're still working with several of the others, about 11 or so, to try to get a really robust plan for opening.
Great, thank you. So the next one is, Another question from the public. Anne says that she's looking at the county's coronavirus numbers broken down by zip code and is asking, could this be a factor for allowing some businesses to reopen? She notes that, for example, Petaluma, Windsor, Glen Ellen, Kenwood, and others have a case rate that is below the state threshold. The question, I guess, is could those areas be opened because their case rate is so low?
Yeah, that's a really good question. I am going to turn to Adam Radke, who's with our county council group. I'm not sure that the state has put out specific guidance about parts of a county opening. I don't know, Adam, if you can speak to that.
Yes, I can speak to that. The answer is that the state order applies to the county as a whole. The state order does not allow, allow some portions of the county to be in one tier, while other portions of the county to be in a higher tier. This is, again, what the state has spelled out in the state order. So it sets the minimum requirements imposed by the state county-wide.
Great. Thank you, Adam. Let's go one more question from the public, and then we'll go to some questions from the media. There's been a number of questions today about youth sports. Kevin asks, is there any updated guidance on youth sports coming that would at least allow the kids to play small-sided games within their cohorts outdoors? Kids are really wanting this and need this, and based on evidence from other jurisdictions, the risk of transmission is fairly low. Do you have any thoughts on that?
Say that is a very good question, and I understand your concern and the frustrations with relating to this, the playing of youth sports. I'm going to turn this over as well to Adam to answer the specifics of your question.
The state has issued what is called the Youth Sports Guidance. It applies statewide to all counties equally, and it does not allow for competitions or tournaments.
Is there some allowance for just practicing outdoors, Adam? That was
yes, it does. I apologize. Yes, it does allow for drills and other activities, provided that those activities can be done with social distancing. So some sports activities that require people to come closer than 6 feet, those would be activities that would not be permitted by the state youth sports guidance.
All right, thank you. Let's go to Martin of the Press Democrat. Martin?
Hi, Dr. Mase. So which sectors and occupations are leading in local virus transmission? What is the status of virus transmission, for example, among farm workers? Is that still, are we, we're seeing an early end to the harvest. Are we seeing those numbers still higher, or are they starting to taper off?
Yeah, we're still seeing outbreaks in the agricultural and farm worker groups. And again, it's all the same risk factors that we've talked about. People live in large dormitory type housing where there's many people housed in a small space. People work and they go to work together as well. And there's been some risk of that as also. So that's why our outreach to this group, this multi-pronged approach to really target the people who are most at risk is so important, because we need to ensure that we're finding people who are cases quickly before transmission occur and give them opportunity to isolate and quarantine. And we're looking at some financial packages to help with wage loss during the time when people are off, that kind of thing.
What about healthcare employees and outbreaks in nursing homes and residential care facilities? What are the latest trends there?
That has definitely come down. I feel like the intense amount of effort that we and the state put into performing site visits, improving infection control practices, giving guidance for cohorting of residents at the facilities. All the testing that's been done, both surveillance and outbreak testing, has really contributed to a decrease in cases in skilled nursing facilities and residential care facilities for the elderly. That includes long-term care facilities, assisted living facilities, et cetera. And it has resulted directly in the decrease in the deaths that we've seen in this very vulnerable population.
And just as a follow, so how concerned are you that the county has not curbed the spread of the virus now that we're headed into cooler days? And as we're seeing virus cases begin to tick back up in dozens of states where, autumn has already set in. How concerned are you about that?
Well, I'm really plugging everybody to go get your flu shot. The influenza vaccine is available. You can get it in numerous different ways. Calling through your doctor. You can even go to CVS Pharmacy or any other pharmacy that's offering the flu vaccine. There's so many ways to get it, and that's going to help because it will make it easier for us to assess if someone is symptomatic, whether they have potentially COVID. If they've already had their influenza vaccine, it's less likely, obviously, that they'll have influenza. So that is one thing I'm going to recommend for everybody in our county right away. As far as the approach now as we move here into October, I'm really excited about the multi-pronged approach to target our hardest hit and vulnerable populations. And I think that this approach is hopefully going to really get at that health disparity and improve our health equity metric.
Thank you.
Okay, let's go to Ann Ernst of the Index Tribune. Ann, can you hear us? You're on.
I can hear you.
There you go.
It looks like, okay.
You're on.
All right, I just want to follow up on the zip code idea. If the state allows that, would the county consider allowing those areas to reopen, the areas that have the smaller proportions?
Yeah, well, at this point, it's not being discussed at a state level. If the state does move in that way, we'll take a look at the zip codes and see what we're seeing and consider our next steps. At this time, the state does not allow the county to do that.
Is there any chance that the county would advocate for that with the state?
Well, I think there's been ongoing discussions amongst counties as well as the state and the best way forward. We have to keep in mind that COVID is easily transmitted from person to person. There's even been talk of making moves more in a sort of a regional approach rather than even a county approach. So many different approaches have been put forth by counties and the state.
Well, yeah, I know there's people arguing that, well, if I can drive from the city of Sonoma to the city of Napa, and I'm not allowed to eat indoors in Sonoma, but I can eat indoors in Napa. I mean, people travel within the counties. So I think people are hoping that there is a regional approach rather than the counties. It seems like it needs to.
That's another model that's been discussed.
Okay, but no movement on it yet.
Not that I'm aware of at this time.
Okay, thank you.
Okay, let's take another question from the public. This comes from Valerie. It's a workplace question. Asking, can you provide some guidance, information on what public health is suggesting or requiring for the use of break rooms in workplaces in regards to allowing staff to eat inside, particularly during bad weather? Any thoughts on that?
Yeah, that is also an excellent question. I'm not sure the state gives very specific guidance, but Adam, I know we've interpreted some of the language. Do you have any thoughts to add?
I know that the state has a office workplace guidance. I haven't reviewed it in a while, but I believe that for common areas, it recommends that those be, give me one second, that common areas be closed or restricted using barriers or increasing physical distancing between tables and chairs where personnel are likely to congregate and interact, such as kitchens and break rooms, and discourage workers from congregating in high traffic areas such as bathrooms, hallways, and stairwells.
Great, thank you.
So it sounds like those kind of break rooms are discouraged, correct?
Yeah, and we have
Correct.
actually seen transmission. I'll just say from our own data in Sonoma County, we have seen clusters of cases that have resulted from just that kind of activity.
Yeah, yeah. Understood. And this is another question, just to clarify on the issue of trick-or-treating. Jackie asks, so is trick-or-treating is not permitted or just discouraged? What's the distinction?
Well, it's a pretty solid recommendation that we're giving not to do that. As you might expect, when parents or kids are going door to door, there may be increased risk of exposure to people who are not in your household because you're going from house to house. So just based on that, it is a strong recommendation and we discourage it.
And it does follow along with what the CDC guidelines as well as the state guidelines.
Yeah, the state has recently put out their own guidance that sort of mirrors that. I don't know, Dr. Baldwin or Adam, if you want to add anything to that.
No, I don't think I have anything else to add. It just does increase the risk and possibility of transmission when you're going door to door, and possibly going door to door with not just your family members too. You might be going with friends and into a little bit larger groups, and that also increases the risk of transmission.
Adam, did you want to add something?
I have nothing to add from a legal point of view.
I think you made the point before that even just leaving out a bowl of candy is not necessarily stop the transmission. That can lead to transmission as well. Okay, let's go to Kelly Huang. I believe is from the Chronicle. Kelly.
Thanks, Paul. Hi, Dr. Mase. I have a two-part question for you. So the health department launched the request for the Latinx community outreach campaign in May, but On the Move was only just selected at the end of last month to develop it. Can you explain why it took so long to get this program going, and what steps have already been taken already to reduce transmission within the Latinx community?
Well, we've been really very proactively addressing the disparity from the minute that we saw it. We noted this disparity probably even as far back as April and recognized that it was something we definitely had to address. Since May, we've been doing lots and lots of pop-up testing. In fact, the proportion of cases occurring in the Latinx at the height of the disparity was, I believe, 77 or 78% of our cases. And now we are down to 54% of our cases occurring in the Latinx. And that's been achieved through a combination of pop-up testing, finding people with COVID, isolating them quickly, following up with their contacts, quarantining the contacts, testing all contacts, asymptomatic or symptomatic, as well as offering them housing at the alternate care site if they couldn't isolate appropriately or quarantine appropriately, or had people who are at risk at home. We've also provided a lot of outreach on our own before On the Move is now starting their project of massive outreach and education to the community. We started our own outreach program with Facebook live streams, a town hall specific for the Latinx population, with bicultural presentations, with messaging through the bilingual radio stations. We've also worked to hire, the majority of our contact tracers are now bilingual, so they're able to give appropriate information and guidance, as well as our case managers. So a lot of work has already gone into this, and we really look forward to partnering now with On the Move going forward to even more really address this disparity.
Thank you.
Okay, let's go to Rachel Schreier from, I believe it's Kaiser News. Rachel?
Yeah, Shire.
Schreier.
No worries. I was wanting to ask about the wildfires that have, unfortunately, you guys have had already a pretty difficult season. And I know that this has been talked about, but with thousands of people evacuating, in recent weeks and having to stay with friends and family or shelters, how are you seeing any connection between, all the evacuations that have gone on and Sonoma County's continuing challenges with its COVID numbers? Or do you have any concerns that you will in the coming days? Can you speak on that a little bit?
Yeah, absolutely. I think that there's definitely a concern that that's going to contribute to increasing numbers if it hasn't already done so. We do know from the Walbridge fire that we did have 30 some people who evacuated who were cases. And of those 30, we were able to pinpoint that 15 of those cases occurred specifically as a result of evacuation. In other words, exposure to somebody with COVID due to the evacuation process. So given that and the fact that our more recent evacuations to the glass fire were actually significantly greater in terms of numbers, it is a concern. I think if we're going to see the impact of that, it will be within the next couple of weeks here.
But you're not seeing anything yet.
Well, we are analyzing our data, and the EPI data is always a little bit lagging behind because we have to get all the information in from our cases and case interviews. So we'll be compiling that and hopefully be able to present some of that data very soon.
Okay, thanks.
Okay, our next question again is from our viewers. This one's from, let's see, this is from Tammy, and I think it addresses a false perception that many people have. She asks, if you have no symptoms and feel okay, can you get a test?
Yes, you can absolutely get a test. Anyone in the county can get a test. In fact, the state-funded testing sites that are in Santa Rosa, and then recently now the one in Petaluma has moved to Windsor, are available for anyone, asymptomatic, symptomatic. If you're just worried because you think you may have had an exposure or for no reason, you just want to get tested, go and get tested. You can make an appointment through OptumServe. It's very fast and very safe, and you'll get your result quickly. It would be, I think it's advised, in fact, with all the evacuations that have recently happened, if people are concerned, they should take advantage of that. As we know, a good percentage of asymptomatic, that is, our cases are occurring in asymptomatic persons. In fact, up to potentially 1/3 of COVID cases could be occurring in asymptomatic individuals. So it makes sense.
Yeah, and just to follow up what you said, that we do have those two test sites, one at the Santa Rosa Fairgrounds, Sonoma County Fairgrounds in Santa Rosa. The other one was in Petaluma, but is in the process of moving to Windsor and will be available in Windsor. And in many cases, you can get same-day testing. You can have an appointment and be tested that same day. So thank you for addressing that. The other question is a more detailed one. It says, when the county records a positive COVID test, do they continue to mark any following positive results for the same person as new, as if they test positive more than once? So how do you deal with those kinds of tests for that individual?
Yeah, so that would factor into our test positivity. Now let me see, Dr. Baldwin, do you know how we are dealing with multiple positives?
I believe we're now aligned with the state, and the state is not counting multiple positive tests, just the one positive. Well, actually, let me get back to you on that, because I'm not absolutely sure, but I believe we are not counting multiple positive tests. I can find that information,
we'll get back,
and I will.
yeah.
We can get it back to you very quickly.
Yeah. Okay, let's go to Mary Callahan, the Press Democrat. Mary?
Hi, can you hear me?
You're on.
Thanks. I want to go back to the plan. Dr. Mase, when do you plan to announce that and release it in full detail? And what is your expectation about when the implementation of that plan would be reflected in changes that would potentially change the tier at which the county would be on the blueprint?
Well, as far as the latter question, that would, require, sort of some speculation, and I'm not really sure that we know when this would potentially help us go from one tier to another. What I do know is it'll really help us address the disparities and bring down, hopefully, the test positivity in that lowest quartile. Now, initially, with a lot of testing and a lot of outreach, we may actually see an increase in the number of positives. So we're not clear how long it's going to take for it to really impact. The good news is it is absolutely the right approach and addresses the disparities. We are working very close with our board of supervisors to get all of these initiatives in place as soon as possible. So the sooner we can launch it, the better. And we're working really hard to get it going.
So I had questions that sort of overlapped on what one of the other reporters asked regarding the Latinx RFP that went out in May, and I'm assuming that there's some overlap between the one quartile and the Latinx community, or those at least that are dealing with some of the housing issues and so forth. What was the holdup in getting that program in place, that outreach in place that was addressing some of those disparities that would also have addressed some of this equity issue? Does that make any sense? Does that question make sense? There was back, many months ago, there was an RFP that went out that was looking for case management and outreach and so forth to the Latinx community to try to address this disparity in the disproportionate number of cases that were occurring in that community. And now here we are all these months later, getting ready to implement that program in addition to dealing with this other equity problem that we're trying to target. And I'm wondering, about the lag time and about the fact that we're just now sort of getting moving on this more complete plan.
Well, I think all along, we've actually been really diving in and addressing this problem. So that hasn't been the issue as much. I mean, because we've had this sort of multi-pronged approach that we've been pursuing that's been very effective in decreasing the proportion of cases in the community occurring in the Latinx. And in fact, we've done outreach to farm workers, other agricultural workers, vineyard workers. We've looked at people who are working in sales and services and janitorial services. We've done a lot of outreach, and I'm really quite happy with that. And now we're really happy to have On the Move on board and looking forward to partner and provide even more outreach and engagement to the Latinx.
Okay, thank you.
Okay, again, we have some good questions from the public today. I have to acknowledge.
Paul, I think that Dr. Baldwin does have a more specific answer to the question.
I do. I apologize. I just checked with our epidemiologist, and the state counts each test. So every time that someone gets tested, that gets counted and added into the numbers and test positivity. So they're looking at just the numbers, but we don't, just because you test positive again within a week or so of the last time you got tested doesn't mean you have to restart your isolation or something like that. So the clinical implication is different than the numbers, but the state does count each time that someone is tested.
Great, thank you.
And I think they also record each time you test negative, correct?
They do, all tests.
Yeah. Okay, this question comes from two of our different viewers. Debbie and Helga ask about when the county reaches the red level, the red tier, and schools are permitted to open, will the county provide testing and contact tracing, or will it still be the responsibility of the school district and schools to provide these services?
Yeah, per the state guidance, it's a partnership. So the schools need to provide all the mitigation factors, ability for there to be, cohorting and, correct egress and ingress to school, as well as cohorting of students and facial coverings enforcement, as well as the social distancing and all of that. And the school also has to have a plan in place for doing their surveillance testing. And I believe that our school districts, public school districts under Dr. Harrington, are already looking at some contracts with company that could provide that kind of surveillance testing for the staff in the school. So they're already kind of working on a plan there. Now, if there is a case of COVID that occurs in the school, that's when the school that has all of the information on who's come in contact with whom needs to give us sort of a line list of who the people who are close contacts are. At that point, as we do for any other business and any other organization, public health gets involved and helps with the actual follow-up of contacts to ensure that the case is probably cared for, isolated, that contacts are quarantined, that the contacts are all tested, and that then we can work with the school to figure out what they need to do in terms of whether they have to close just that particular class, or if it's a bigger issue and they need to consider closing the school, and then work with them towards reopening. So it's a partnership.
Great. Another question, and this is a probably pretty easy one. Melanie asks, when are play structures for young children in Sonoma County going to be allowed to reopen? I think they already are open, right?
Yes, Adam, do you want to comment on that?
They are allowed to be open now under the state and under the local lines.
Yeah, the state came out with some new guidance there, and that was implemented. And yeah, we take our lead from the state on that. Let's go to Ted Williams from KZST. Thanks for being here, Ted.
Thank you. Thanks for letting me be here, Dr. Mase. Paul, good to see you. I'm kind of going back to the basics here about cleaning products. We see those atomizers that are used in airplanes, and see a lot of that in the news videos. Is there a home brew solution that we can use for our playground sets at our own houses where, neighbor kids might come or something like that? What's the percentage of alcohol or of bleach that we need to have to really be effective for the virus?
Yeah, that's a good question. All that is going to be found on the state's website, CDC website, but I don't know, Dr. Baldwin, if you have any further information about specifics of cleaning agents. Maybe we can certainly provide you with that, Ted, but I don't know if Dr. Baldwin knows anything further.
No, I don't.
I know that it gets a little expensive when you get into the commercial stuff, and for just homes, one or two people, it might be something a little bit cheaper. And then as far as UV light, there were some UV light generators that were used in law enforcement, EMS vehicles, things like that. Is that still something that you recommend?
UV light is not going to be harmful, and it certainly has been shown in some circumstances to kill certain bacteria. For example, with tuberculosis, it's effective in killing the bacteria. COVID still being a relatively new pathogen, we may not have as much information about, but it certainly isn't going to hurt to use UV light.
Yeah, you could throw your mask up on the dashboard in between using it and let it sit in the sunlight. Okay, thanks. I'll pass along to others. Thank you.
And I think Adam has put into the chat a website that you can go to find some more information on the cleaning products.
Great, thank you.
Michael asks about the 3 families rule or 3 households. He asks, I thought it was 12 people, but don't remember the 3 households rule. He's asking about where that comes from.
Yeah, that's with the latest state guidance on gathering, and I think I'll turn that over to Adam to just quickly summarize that.
Yes, so the state released on Friday a guidance that would allow for different households to get together to participate in outdoor activities together. It limits the number of households to no more than 3 households. The state gathering guidance works with the local order that also permits individuals of up to 12 to gather outdoors, provided that there's social distancing, compliance with wearing face coverings, and compliance with hygiene. Those would work together. So gatherings in Sonoma County may occur outdoors with different households, provided that it's no more than 12 and no more than 3 households.
Great, thank you, Adam. Annabelle asks about the financial packages or incentives that are part of the new initiative. She says, what kind of financial packages will you be offering people who are not necessarily in the high risk group, but are COVID positive and are low income?
Yeah, so we're going to focus our efforts on that lowest quartile, the people who are most affected by COVID at this time. And we're kind of looking at some different models for what we could do. We're thinking about a financial sort of a stipend that's given to a person when they get diagnosed with COVID that would help them with lost wages, that would, if they don't have sick leave, if they don't have any unemployment insurance, that would cover the days that they have to take off. We're also looking at giving them some sort of a voucher or other program to help them isolate in a hotel that might be closer to their home. Right now we have an alternate care site that's in Healdsburg, and granted it's a little bit far for some people. So we're thinking about giving that same opportunity to isolate in a hotel closer to home, or to quarantine if you are contacts in a hotel closer to home that's fully paid for, with meals during that time when a person stays there. We're also looking at some incentive payments potentially to get people to come out and get tested in our pop-up testing, so that for any transportation or other inconvenience that they face in coming to get tested. So these are just some ideas. I don't know if anyone else wants to add more, but much more on specifics on this will be coming out soon as we work with our Board of Supervisors to get this all in place.
Great. And another one of our viewers is concerned about the mental health issues facing our community. And she asks, can we get numbers on the suicides and drug overdoses that have occurred during this lockdown? Dr. Mase, I know you've reported on those trends fairly recently on a fairly regular basis.
Yeah, you'll find those in the board presentations, but in summary, we have not actually seen a market increase or actually any significant increase in suicides if you look at this year compared to the last 3-year average, for what it's worth. Remember, the numbers are low, so we may not see a really big significance there, but that's good news so far. However, we have seen an increase in overdoses, especially sort of opioid-associated overdoses, and that is of concern. I share your concern in that. And we do have evidence that people are undergoing depression, anxiety, isolation, fear, loneliness, anxiety. All these things are happening, and we do have a mental health warm line that's available to people who need to call and talk to a professional. Both in Spanish and in English, we provide that service. There are other services that people can take advantage of. They're all on our website at socioemergency.org. And we will again be providing the up-to-date information on the things that you're asking about.
Yeah, and I just want to, on that note, I just want to let people know the warm line is confidential and is open to anybody. It's free. And the number is 707-565-2652. That's area code 707-565-2652. And they have people available to just talk to you from 10 a.m. to 7 p.m., 7 days a week. Let's go to Martin. Do you have a follow-up question?
Yeah, thank you. So I think some people are wondering if there are going to be any additional restrictions envisioned for the plan that you're going to announce. what aspects of public life or business might be affected by this action plan?
By the action plan that's targeting the health disparities?
Yeah, yeah. Are there going to be any additional restrictions envisioned in the plan?
No, there's no restrictions envisioned at all. This is all outreach, education, increased testing, financial assistance, help with isolation and with quarantine, more services, if anything, for targeting the community to try to mitigate the disparities and decrease COVID transmission.
And a follow-up to the that question that I asked about the potential second wave, are we prepared for that? What new preparations would you point to that make you confident that we are, if we are?
Well, I think that if there were to be another, second wave of an increase, that we are prepared. We're working with our hospital partners, with our federally qualified health centers to ensure that we have healthcare capacity, that, the surge capacity in case there's increased hospitalizations. We do have the alternate care sites in place. So from that perspective, I think we're fine. And it's a matter now of watching, waiting, and really implementing this multi-pronged approach to help people help themselves in the community.
And would you expect this second wave, if there is one, would you expect it to be worse than the first, or not as bad?
Yeah, these are really great questions, Martin. It kind of really depends on how different factors are impacting our case numbers and rates. We don't know, for example, how the fire and evacuations recently in the last, 3 weeks or so impacted our rates. So that's an unknown factor. I do think that since we're still in a more restrictive phase, purple tier, in other words, and many things have not opened yet, that I don't expect that we'd see the huge increases that had been modeled when there were no restrictions. We're also not in a complete shelter-in-place model, which really drove down our rates. So we're somewhere in between. It's a little hard to have that crystal ball to see what's going to happen as we move forward. But I think with our multi-pronged approach and plans that we're implementing, I hope that they'll be impacting this whole thing in the right direction.
Thank you.
I want to go to one more question from the public. We have a few asking about why is it that the casino, the Great Casino in Rohnert Park, is allowed to be open? They note that it's attracting many people to the region for non-essential purposes, bringing tourists into the area. Do you or Adam want to address that?
Yeah, it's a great question, and I think Adam might be the right person to address it.
The state has issued guidance specific to tribal casinos. And because we are operating under the state order, because the local order is aligned with the state order, casinos are allowed to operate consistent with the state's tribal casino guidance, which does allow for this kind of activity to take place.
Great. Thank you, Adam. Okay, for our last question, let's go to Mary Callahan for a follow-up. Mary?
Hi. No, I'm forgetting what it was. I was just wondering, I guess, where the impetus to develop this multi-pronged plan came from, whether it's been something that you guys have been debating since August, since the state blueprint went into effect, or is it something that, in other words, is it only recently that you decided that you needed to do something additional to try to reduce our status?
Well, I think that the state's been talking about this health equity metric for some time now, and really trying to figure out what's the best way for them to develop a metric that would meet the needs. And I think it's a great plan. This health equity metric came out on October 6th and got implemented. And it's changed quite a bit in as it was being discussed with health officers and and the local county health officials. And when we saw it, it was very simple at that point, what we needed to do. You know, it's a very good way of trying to close the gap and address our disparities. And so at that point, it was very clear we needed this multi-pronged approach. The state has also, Mary, just put out a playbook that's very comprehensive. I don't know if you've seen it yet, but it's something that I don't know if it's been released to everybody yet, but it's an excellent framework for addressing health disparities. So this has really spurred us to do even more than what we were doing before.
So in other words, this is driven by the health equity issue. It's not driven by the fact that we've remained in purple for 6 weeks.
No, this is the health equity issue that we've been, I think, really dealing with head on since April. And now we just realize that there are even more, we know what the challenges are. In other words, we've learned from the last several months what we need to do to get where we need to be. And the health equity metric has brought that to the top. And it's been a really positive thing that the state has put out that's helping us now work to really address health disparities in the community.
Can you identify what the factors are that determine that identify that quartile, like specifically? It's socioeconomics, but is it specifically income? Is it's housing? What are the factors that you consider?
Right. So it's based on a healthy. Is it healthy people's index, Dr. Baldwin, or places index? Healthy places.
Yeah.
Healthy places index, and it is a conglomerate of like 9 different things that are looked at.
Yeah.
One thing is just economics, the income, but then there's education and access to healthcare, and I don't know, there's a bunch of other things that go in that. We can show you the, I mean, you go to the website and see, but it's an indicator that's been used for determining the health and wellness of different parts of the community based on the index. And it's been something that's validated and used a lot.
Okay, thank you. I've taken up a lot of time. Thank you so much.
Okay, it's the bottom of the hour and we're going to wrap this up here. I just want to thank everybody for being here today. I want to particularly thank our viewers and our media friends. You had all great questions today. We'll be back. We'll see you again next Wednesday for another one of our community briefings. And until then, stay safe. Thank you.
Thank you all.